this is another in a series of our ABSW HAWK COVID-19 initiative town halls. I counted them with Carla's help just prior to coming online, and this will be number eight of our town halls. And so we've been at it since March of 2020, and proudly so. This also means that as things continue to develop with the pandemic, we are out ahead of each development with a town hall. We've been successful so far in being ahead. So yes, good evening to everyone who is joining us, and folks are talking in the chat. That's very nice. So tonight, we are going to feature a panel presentation. It's very informal. This is like getting together in someone's home and just having conversation. That's the feeling we like. And we are going to have tonight lots of time for interactive questions, conversations, because that's important. I think it would be fair to say that through every step of the pandemic, from the very beginning, before it was even called, before a state of emergency was called in Nova Scotia, we have anticipated that, you know, we would be here, that there would be a need for culturally specific response for our people to the pandemic. And tonight's topic is certainly no exception. If anything, it is an area I know of some concern for people. So we have said, and we always say, that keeping our people informed is our priority. It's not about having one fast opinion as opposed to being open to all kinds of opinions, but it's an opportunity to provide the facts and to have easy conversation. So with that, I'm going to ask Sister Veronica to I didn't even introduce myself. Sharon Davis Murdoch, you can see it up there, co-president and founding member of the Health Association of African Canadians. Over to you, Veronica.
Good evening, everyone. Thank you guys so much for joining us this evening. I know everybody's schedule is very busy, and so the fact that you took time to join us is greatly appreciated, to the panelists as well as to those who are attending, to gather information that they can then take back and share with others. So as you can see, I am Veronica Marsman. I am a social worker practicing until the end of this year, and then going into retirement. Looking forward to that. I am also the co-manager of the COVID initiative with my partner in crime, Sharon. And this is, as Sharon has indicated, this is probably, Carla can give us the exact, but I think this is either our 4th or 5th town hall that we had on COVID since it started, and our first one being on facts and myths. So we're trying to give people the right information on COVID at every stage. If it was the vaccine, we had a town hall, and now we're having this one for children, and then there will be a future one. Just wanted to share with you, or do I just turn over to David to introduce himself for sharing?
Yes, I think you do.
Okay, yeah. Okay. So that's me.
So you don't want to do your thing first and then let me.
Well, that's what I just asked.
Yeah, why don't you go ahead?
So
yeah,
why don't I do it and get it over
rather
with?
than jump to me and back to
All right,
you. Yeah.
so back to me. My apologies for the confusion.
No, okay.
So just to give you a little bit of information on our initiative, the COVID response/impact initiative for people of African descent in this province. We initiated this when COVID first hit, and we set up a toll-free line for people of African descent to call in. And to date, we've received close to, I just did the stats, 900 and some calls since inception. That might be under. Anyhow, since our last newsletter, it's been close to 250 calls since June. And it peaks and ebbs and flows with it, because when there's issues, when we go into another shutdown or lockdown or whatever, then calls come. We deal with, on the toll-free line, people are calling in looking for information on proof of vaccines. Where's the next vaccine clinic? Where are they located? Where's the testing site? They're looking for supplies, whether it's a blood pressure machine, thermometer, issues on employment. They're using it as a toll-free needs and services line. And that's how we're venturing. Initially was set up only for COVID response, and now we're COVID plus. So it's a Black community toll-free line. Financial assistance, mental health support, how are we all coping, grief sessions, all of that information. If people don't know where to go, they can call the toll-free line, and we then will triage them to the appropriate resource. So we're really pleased with the work that we've been doing through the toll-free line and through our COVID initiative. We are preparing to have completed our 4th community newsletter, because we want to keep everybody informed. So that will be going out mid-December. It'll be a nice Christmas gift for folks. And also stay tuned for another town hall coming up. So I think that's a quick summary of our COVID initiative.
All right, over to me. So good evening, everyone. Good to see you all. Good to be here with you. So I'm Dr. David Hawes, and I'm ahead of Veronica because I retired already. I'm a retired physician.
Not really.
Not really, yeah. So I did infectious diseases and internal medicine. So, and I'm part of the COVID response impact team, doing some of the medical stuff, and also a member of the Health Association of African Canadians. And basically just wanted to give you a little bit of history. You know, there's a huge concern about not just COVID, but the vaccines. And there are lots of questions that came up that we've addressed over our last couple of town halls. But I just wanted to just give you a little brief summary of what has happened with us and our communities when the vaccine came along. So in March last year, we were approached by the COVID-19 task force, which was really spearheaded by the Department of Health and Wellness. They had Public Health on board, and some other groups. African Nova Scotian Affairs came on board as well. And we actually had the opportunity to set up some vaccine clinics for Black communities in a very special, very culturally specific way. And so what we did is, first of all, we had a system where we had coordinators from the Association of Black Social Workers who did booking and registration. And we had clinics which were held in specific areas. We took the clinics to the communities rather than set up a clinic and say, hey, come on down. We made sure to have clinics that were within easy reach of our communities. And so we set up the clinics. We had people from our communities who were at the clinics. There were greeters, there were people who were helping with the flow of the clinics. We even had vaccinators who were from our communities as well. And I'm here to tell you that it worked so well that we had very good feedback from individuals who walked in and, felt so at home when those clinics were being held. So we had several of those clinics, 15 in all, actually, between March and I think August of last year. And then after that, we have continued to provide vaccinations for communities, but in a different way, where the clinics, we call them pop-up clinics. So the mobile health units from the public health have been instrumental in putting on these clinics for us. And with those specific clinics, we had about 14,000 individuals of African descent who actually were immunized at those clinics. It's about 60, just over 60% of the 2016 sort of population statistics. So, you know, we're continuing to do this work. Our next step is, and the reason we're having this town hall is our next step is going to be the vaccine for children 5 to 11 years of age. The vaccine is not yet accessible, available in the province, but we're having discussions as to how to have those clinics. And we feel that for Black communities, having those clinics in a child-friendly space, such as, you know, gymnasiums at schools. We've thought about maybe some of the early child education centers. But anyway, we're looking at places and spaces where children and their parents will feel more comfortable in coming to have immunization. So again, you know, this is just the beginning. So we want to just acknowledge that you know, it's good to have you here and to have some presentations and discussion in regards to the 5 to 11-year-old vaccine for COVID-19. Thank you. All right, I guess I continue, don't I? Yes.
You
Looking
do.
at my
That would
script
be
here.
right, Dr. David. That
I'm
would be
looking
right.
at my script here. Okay, so we have four panelists with us
Yes.
this evening. I'm sorry. And what we're going to do is ask our panelists. We have 3 questions that we've sent out, and we ask our panelists in about 10 minutes to address either 1, 2, or all 3, whichever questions they feel are appropriate for them. Even if it's only 1, that's fine. And we're going to ask you to introduce yourself and then do your presentation. And we're going to go in order with Dr. Allen first, then with Dr. Sommers. And then we'll go from there to Ms. Fraser and Ms. Johnson finally. And then after that, we'll go into Q&A. So Upton, if you don't mind going ahead and.
Thank you, David. I'm Upton Allen. I'm a professor of pediatrics in the Division of Infectious Diseases at Sick Kids at University of Toronto. And I never say no when David asks. So, you know, that's important. Never say no to David. But it's really great to be here. I thought what I could do, David, is just use a few slides to just answer some of the questions that have been posted. And I'm going to try to see if I could share my slides. And if you could let me know if you're seeing them in
Yep, it's there.
slide. Are you seeing them in slide mode?
Yes,
Yep.
they were now.
Presentation mode. Wonderful. So with a focus on the COVID-19 vaccination for young children, 5 to 11 years of age, as we try to prepare for vaccinating these children, I think it's important for us to be able to articulate what are the benefits versus the risks. And I thought I'll just go through those. It's clear that benefits outweigh risks, but you know, there are risks, and we'll talk about them. On the benefit side, the thicker, wider square that you see there is the impact on individual illness, such as acute COVID, multisystem inflammatory syndrome in children, long COVID, and then the impact on disease transmission. And then on the other side of the equation, in terms of risk, would be myocarditis, pericarditis. With respect to the potential impact of vaccines, we recognize that as we move into the respiratory virus season like now, we're going to see SARS-CoV-2 behave like just any other respiratory virus, and we're going to see more cases, and they're going to be among 5 to 11-year-old kids. And we'll see more cases of acute COVID. We'll see more cases of the multi-system inflammatory syndrome in children, and potentially long-term sequelae such as long COVID. Now, we know that kids get overwhelmingly, when they get COVID, they get mild illness, but some do have severe outcomes, particularly those with risk factors. And we know that the multi-system inflammatory syndrome can be quite devastating. Long-term sequelae are still being well defined, not as adequately defined, but they're still being defined. And to that end, we know that kids do get this particular entity less than adults, but we also need to recognize that signal detection in young children might be less precise than in adults. Like, for example, adults get brain fog. How do you ask a 3-year-old if they are having brain fog? So these are things that we just need to be aware of. If you look at potential impact on disease transmission, children can serve as important reservoirs. Asymptomatic kids can shed for a couple of weeks. And kids could be potential sources of infections in the school setting, in the community setting, and in home. And so vaccines will contribute to reducing the overall risk of transmission from children. But we also need to recognize an additional benefit, which is really important, and that is the ability of vaccines to help us to restore safe and effective learning environments for these kids, getting them back to school, and thinking of the beneficial effects that this would have on their mental health and well-being. This has been shown to be a major concern. So there are a number of benefits on the benefit side of the equation: impact on illness prevention, impact on disease transmission. As leaders, we should be able to articulate this to the communities. But we also need to recognize that there are risks, and people are asking questions about the risks. And so if I may just take us through a few slides to begin with, what are the data that are accompanying the recent approval by Health Canada of the Pfizer vaccine for kids 5 to 11. Bottom line is that a lower dose, 10 microgram, was studied, and this was shown to be equivalent to a higher dose being used in young adults in terms of the ability to develop neutralizing antibody titers. So 10 microgram worked for the kids, so that's good. And the other point is that when they looked at the vaccine efficacy, comparing active vaccine versus placebo, the vaccine was 91% effective, with about 1,300 people in the vaccine arm and just over 660 in the placebo arm. So about 91% effective. With respect to the question of, well, who are the people in these studies, and were racialized folks and Black folks included, Black or African American, about 6%. It's a little bit lower than the 10% or so for the adult trial, but it was, the companies are making an effort to include more diversity in the clinical trial so that more generalizability could be made. Safety has been looked at, just over 3,000 individuals, and no real bad signals have been detected to date, but monitoring continues. Now, I'm going to fly through this, but essentially what this is showing is that when you compare the 10 microgram dose, where the cursor is, to higher doses, like 30 microgram dose, the lower dose in kids was associated with less arm redness, swelling, pain, not as much, but a little bit less after dose 1 as well as dose 2. And if you look at systemic side effects, the lower dose was also associated with less fatigue and headache compared with the higher doses. So essentially, in summary, then the evidence was suggesting that 10 micrograms worked for kids and was associated with less local and systemic toxicity, the so-called reactogenicity. So that's really good. But then there was some, fly in the ointment. And what was that? And that is the myocarditis issue, which was discovered prior to the 5 to 11-year-olds vaccine studies. And basically, it was shown that myocarditis, pericarditis was tended to be higher following the second dose of the mRNA vaccine rather than after the first dose. In Ontario, when we looked at this, and we seem to have had higher rates than elsewhere, when we looked at this, we actually found that the rate of myocarditis, pericarditis was higher after the Moderna compared with the Pfizer. And there was the assumption that this was possibly dose related. And with that, then, the use of the lower dose of 10 micrograms compared with the 30 micrograms in older individuals was seen to be a key step. But also, there are data that showed that the older individuals tended to get myocarditis, pericarditis more frequently than the younger teens. So, for example, individuals in the age group 6 to 19 would have higher rates than individuals 12 to 15. And the assumption is that individuals less than 12 would have even lower rates. And so I think overall now we can say that it's reasonable to predict that post-vaccine myocarditis rates are likely to be very low in the folks under 12 for two reasons. One, the expected lower rates of myocarditis that are related to age in that age band, and also the use of the lower dose of the mRNA vaccine. In fact,
Dr. Upton, might I just ask, for those of us who aren't terribly familiar with those terms, could you sort of give us a layman's definition of pericarditis and myocarditis, just so that we?
Yes, thank you so much. And so myocarditis is, you've heard a lot about it in the news. It basically, what it really is inflammation of the heart muscle, and the pericarditis is inflammation of the sac that the heart muscle sits in. So the pericardium, then the tissue around the heart, and when that's inflamed, it's called pericarditis. And myocarditis, when that happens, it's the muscle of the heart. And that can affect the ability of the heart to function well. But the important point is that the cases of myocarditis and pericarditis that have occurred have, for the most part, overwhelmingly been very mild. And so I think it's important and to note that if you look at an individual who is 16 to 19, they're more likely to get these two entities compared with individuals 12 to 15. And it's expected that individuals less than 12 would be even less likely to get it. It's going to be a low signal. It appears that the likelihood of these entities seems to be connected with hormones. So male hormones are more likely to be associated in experimental studies with this particular entity outside of the setting of vaccination. And it seems to mirror what happens with the vaccines. And so pre-pubertal individuals would be expected to have a very, very low rate of these entities. So I'll end with one additional point, and that is the showing the difference between the adult COVID vaccine and the pediatric vaccine, they have different colors so that, it minimizes the chances of mistakes. So the kids, their vaccines must come out of an orange capped vial. The formulations are different. There are other things about them that are different, but I just want to highlight one thing, and that is the kids' vaccines should come out of an orange top vial, whereas the adults, it's out of a purple top vial. So with that, David, I'm happy to stop, and then as we go on, I'm happy to take questions or to have discussions about some of the things that you mentioned, including creating a child-friendly environment to vaccinate the kids. And I can share with you some of our experience in Ontario so far. Thank you.
Okay. Thank you very much, Upton. So we're going to move along. Essentially, we will have the opportunity for questions and answers. And Upton, we would love to hear about your experiences from Ontario. You can put questions in the chat. We'll keep looking at those. Or when we get to the Q&A section, you can raise a hand and we can talk. So we're going to go straight ahead. So Ryan, I'm going to give you the space to do your presentation, please, and thank you.
Great. Thanks, David. My family doc and a public health physician in Nova Scotia. I'm the medical officer of health for the Northern Zone in Nova Scotia Health, which is the Colchester, East Hants, Pictou County, and Cumberland counties. And usually I'm in that area doing my generalist public health work and some primary care now and then. But since COVID, all the medical officers of health are working together to address all these issues at a larger provincial level. To participate, a no-brainer to David. Many colleagues and I have of his teaching over the years, so he's an excellent teacher and is very well liked, and still is a great doctor. So happy to help out any way I can. Dr. Allen did a great job summarizing a lot of the science around the effectiveness and the safety of the vaccines. And I think the big thing that big message I would get across: safe vaccines in Canada. We have a very extensive approval process on how we determine if a vaccine will be allowed to be used in their country. So there's a couple steps. There's Health Canada first gets an application from a vaccine company saying we want to bring this to market. Health Canada will review their data, determine if it's safe and effective, and then it next goes over to the National Advisory Community Immunization, which is a group of mainly volunteer experts in public health, infectious disease, epidemiology, pediatrics, internal medicine, and they provide an unbiased review of the data and explain how should those vaccines be used in our country. And so that was recently Health Canada and NACI released their findings just a couple days ago. So it was great timing with this presentation. And I think that the important thing is that they have very, very high standards when they review these new products. They want to ensure that they're very safe. Whenever we put someone or individual to prevent any future illness, and we want to make sure it doesn't have any complications. So we also have a very extensive safety and monitoring system as well. So in our province, if a healthcare patient and they suspect that they may have had a reaction to a vaccine, it's the law for that healthcare provider to report that to the government here in Nova Scotia, and then we share that with the federal government to help monitor for any issues with vaccines. I mean, the big thing for the effectiveness of vaccines, I think they're probably the best way for kids 5 and above to prevent them from getting COVID. And the important thing is that also this means protecting their family and the larger community. So we know that the vaccine at the individual level is, works very well, as Dr. Allen has shown. But we also know that the virus is changing. So there's these different versions of the virus now called variants. And the most common variant right and what we're finding with this particular variant is that it's a bit more transmissible in kids compared to the first time we saw the virus, almost 2 years ago now. Back in wave 1, we saw that, kids were, not really getting sick with it, with COVID. We had families where the parents got COVID, the kids didn't get it, or we had a couple of families where the kids got COVID. They were very, very mild symptoms or no symptoms at all, and they didn't really spread it. And so some of the theories in this in a way is, in our upper airways, along with tissue in there, there's these little receptors the virus likes to attach to. And kids don't seem to be well developed in having those receptors, so the virus can't hook on. However, with the variants now, they're actually changing and they have mutations now that are making them more sticky. So they get more sticky and they stick up in the nose a bit better. And so we're seeing kids transmit it more in their household compared to the first wave. They're not seeing the same level of severe disease, but we are seeing that in households where people aren't masked, they aren't distancing, we're seeing it spread much quicker within households. The other big advantage of what we know about this vaccine is going to let kids be kids again. And so the biggest thing is going to keep kids in school. It's going to keep them participating in sports and their extracurricular activities. What we have seen so far in the fourth wave in Nova Scotia, the majority of our cases have been in children under the age of 11, under 12, 11 and under. This darn virus is pretty tricky. It's finding those populations which of individuals who aren't vaccinated, and it's spreading quite easily. So we've actually, for the first time this September, we've actually had to close a few schools. We saw a lot of the virus in the school setting. We actually never had to do that with our the first three waves, but this wave we've had to close it down. Again, being more cautious and realizing that we want kids in school, we want them to be interacting with others, but we don't want the virus to spread and have other impacts on the school population. So by getting the vaccine, we're expecting in the next few months the number of outbreaks in schools will decrease, and the need to actually shut down a school will be gone altogether. I can attest, I have 4 kids, and it was extremely challenging when we had our lockdowns and the kids weren't in school. It's really challenging to have to teach kids from home. So I think we're eventually going to see that the lockdowns have had impacts on our own children's development. It's probably impacted their social development as well. Kids need to be at school interacting with their friends and their teachers. But we do have some really studies from wave 1 that when kids are in lockdown, they don't do well with online learning. They tend to have more screen time. So they're watching another extra hour or 2 a day of screen time or playing video games. They're not as physically active, and they're eating much more food. So there's one thing about COVID on the person as a result of the infection, but the lockdowns and stuff have a big impact. And in our province now, over 80% of the population have gotten vaccines in arms, and we're preventing lockdowns now. So kids are getting back to doing the everyday things they're doing. The question on to is what have you heard about? How should we prepare for for children for the vaccine? And so obviously having culturally sensitive clinics, and that's something that was very successful in wave 1, where you have your peer group coming in, being supportive of people getting vaccinated. That's going to make a huge difference. Making it children friendly. It takes a little more an effort to put a needle in a kid's arm. They need that reassurance, they need that safety. But there's a couple of things that individuals can do as well. So, part of it is just talking to your kids and getting them primed and prepared, and say that we're going to go to a vaccine clinic, we're going to get a needle today. I think some kids are still going to have the little needle phobias, and you have to, walk them through that. But a couple of things that have been recommended. There's a researcher here at the IDBK who does some work around decreasing phobias and any pain associated with needles. And so a couple of things you can do is get the numbing cream. In my house, we call it the magic numbing cream. It's called EMLA. You should be able to buy it. It's actually behind the counter. So if you ask a pharmacist, they can get that for you. And it's just this cream you put on about 30 to 90 minutes before the get the vaccine. It's a little white cream you put on with this little sticky clear or Band-Aid you put on it. The only thing I recommend sometimes make right spots. So I've seen people sometimes come in and put it down here lower on the arm. That's where you actually take blood. That's not where we're going to put vaccines. You got to put it higher up. So we always say the deltoid region. So the back part of the flabby part of your arm up here, that's where it has to go. So we do that for our kids. Distractions are great, whether it's a favorite toy or watching a video on a phone or a tablet, that can help. Relaxation techniques can help as well. So using some controlled slow breathing makes a difference. Telling people to sit upright makes a difference as well. I think someone's, thank you. So those little steps can actually make it really beneficial to make the experience really something that the kids are not going to get too worried about. So it's the exact same process like a flu shot, same type of needle. It's a very small needle. It goes right into the muscle. It's not at an angle. Sometimes some needles go on an angle. They can be a little more sore. But the big thing to tell people that the most common side effects are going to be soreness at the site, a little bit of redness, might feel achy for a day or two. Some people will have a fever. But the vast majority of individuals who've gotten their vaccines, adults and kids from the studies, they do very well. The one thing we do find is at the second dose, sometimes the side effects are a little more pronounced, a little extra tired, sore. But again, most people do extremely well with the vaccine. And finally, the last thing I'll say about the vaccine is that side effects do occur. Some are expected; they are known. But we do know that there are more problems getting COVID than actually the side effects from the vaccine. So again, the benefits of getting the vaccine outweigh the risks, like what Dr. Allen has alluded to in his presentation. So it's like things like myocarditis and pericarditis, those inflammation back around the heart, they're actually worse in people. Like you'll see more of that in people who get COVID, actually those who get as a vaccine side effect. So so it's always put in perspective comparing the side effects of the vaccine versus what happens if you actually get COVID. So but I'll leave it at that, and I will continue on with other panelists. So thank you again for having me this evening.
Great, Ryan. Thank you so much for that. We're going to move right along. Trina, you're up next. Please and thank you.
Hello, everyone. My name's Trina Fraser. I'm the Executive Director of the East Preston Daycare and Family Resource Center. It's an honor to be on here tonight. And after listening to all the doctors speak, you've answered a lot of my questions that I had for myself. A lot of the parents today knew that I was coming on tonight, and a couple of them called me and they were really asking and voicing some of their concerns. And they gave me a couple questions to ask, but I think that's something I can ask as we get into the question period. One of the biggest things that I'm hearing, and first maybe let me start by saying that even in the beginning of the first vaccination for the adults, there were many adults who were kind of leery about getting it, but since they learned more about the vaccination and the pros versus the cons, they've stepped forward and have since had the vaccination. So I've spoken to a few of them and said, like, think about how you felt when that first happened versus how they have even more concerns because these are their children. They don't want to expose them to something that they don't have much information about. But I'm thinking that even if this presentation was shared with them, Dr. Upton, you showed the charts and the statistics, so they can put value to it to know that there have been what Dr. David had said in regards to setting up different clinics within the community. I've witnessed very, very important to do that, to have child-friendly sites. And even as much as I say that, then I think, okay, we could open up the daycare and say, oh, here's a site, you're welcome to come in. And then I'm thinking, okay, do I want to do that for the children who may be petrified and then they'll never want to come to the East Preston daycare again. But having that security within community, allowing them to even see some of their teachers, some of the folks that they see in the after school programs. I'm scattered. I'm just trying to answer all three questions in one. But I think the most important thing is getting the information out to the parents. And Veronica, the ABSW did an awesome job through the pandemic in providing culturally sensitive information, posters, videos, you name it. And I think that's something that the children need to see. I'm even thinking, okay, what types of books do we have at the center that we could share? Although we're a childcare center for children ages 3 months to 10 years, we do have 22 5 to 10-year-olds that attend our center. And it's been those parents who have approached me many times. I've been very open with them in regards to saying we need to listen to the professionals, given the ins and outs. But again, I think it's maybe something that I could put on our website after tonight. But I think once more information is provided to those parents, it will help sway them in the right direction. We do have quite a few parents, children within our center that have never been vaccinated. So that's another question that's being posed. Is this going to be mandatory? And what do those parents do who have never given their child a vaccination? I come at it with a respect approach, but I think by providing more and more information to those families would be very beneficial. And again, like I said, there were many families who have approached in the last little bit to say, I realize that by me getting vaccinated, I'm protecting my grandparents, I'm protecting my children. So I think as we move forward and that information can get out there, people will come forward. That's all I'm going to say. Thank you for this opportunity, and I will have questions.
Thank you very much, Trina.
Later.
Well said, and we'll be coming to you for some of your great ideas as well as we move forward. So, Teresa, I'm going to ask you to do your presentation, and then we'll go into some Q&A. Please and thank you.
Perfect. Thank you. Good evening, everybody. So I'm Teresa, and I am from Windsor, Nova Scotia, just to get that out of the way for everyone this evening. I refer to myself as a daughter, a sister, a friend, an auntie, and a social worker, both by profession and heart. I happen to be the current professional practice leader at IWK Health for social work. I have a clinical practice in the NICU and in private practice. In the private practice world, focusing on infant mental health, circle of security parenting, and family relationships, and have professionally been learning from children and families since 1995. So long time now. Don't do the math, please. So I'm going to shift our focus, I think, a bit tonight, and maybe build a little bit on what Ryan was talking about, and spend some time to explore the emotional component of the vaccination experience. Recognizing what we do and how we do it really matters. And so my best hope tonight is to be able to share some practical strategies that you can walk away with and that you can use to have a better vaccination experience, both for you as parents and caregivers of your child, and both for yourself and for your child. I'm going to call them Teresa's tidbits. There's 3 of them to get us started. But before I jump into them, I think I should probably say I feel like they are based on the assumption that you are your child's favorite person. And it's the relationship and the connection between you and them that offers comfort, shared delight, joy, help, protection, and maybe even support to help them organize what they're feeling and to make sense of everything that they are feeling. And as you already know, they're watching you like a hawk. They're watching every minute, every hour, every day of what it is you're doing. So they're really looking to you to give them the cues of safety. And they're looking to you to determine, is this safe? So let's jump in. We'll look at tidbit number 1. Sorry, all of my phones happen to be buzzing at one time. So they're distracting me. So yeah, tidbit number 1, I'm going to call that tune in. Let's tune in. So you're going to tune in both to yourself and to your child. So what are you feeling? What's your anxiety level? What are the sensations you're experiencing? What message do you happen to be sending to your children? What message do you want to be sending to your children? And how can you kind of travel back to be in the here and now and present moment with your child? You are the bigger, stronger, wiser, kind presence in your child's world. And so whenever possible, can you follow their need? And whenever necessary, can you take charge in that moment? Children are really aware, or very aware, I guess I would say, and tuned in to the emotions of their caregivers. So in other words, it's really important to kind of try to stay calm yourself, be supportive, maybe use a matter-of-fact tone in your approach as you kind of hold that space for all their emotions to come up. So tidbit number 1, tune in. Tidbit number 2, talk, talk, talk. Talk about the vaccination. Talk about the vaccine. Talk about and validate their concerns, questions. Maybe get together. You don't know the answers. You're not the expert. Look it up together. Call 811. Call a local community member, someone in the community who may have an answer, or as Veronica shared earlier, the 1-800 number that can get you and connect it with the resources that are available to you to address your questions and concerns. I think it's important to say that, we should also recognize that it's their body. We do a lot of work with children to recognize respecting their body. And so it's really important to make sure that they feel safe and comfortable with what's going in their body. Telling the truth is really important. So it's probably important to kind of say, it's don't lie and say it won't hurt, but say something like, yeah, it's going to be uncomfortable. It might feel like a pinch, but it will go away quickly. It's your child, as your child starts to express emotions about this whole experience and what they're about to get involved with, it's okay for them to express emotions. That's healthy. That's great social and emotional development. And when we say social and emotional development, we're talking about their ability to have relationship with people, but also their ability to label, first of all, probably recognize their emotion, label their emotions, kind of manage their emotions, and then share their emotions with someone. That's what we call emotional regulation. And so that's healthy, and it's okay to feel worried. And your role as a caregiver or a parent is to just be with that emotion. Don't try and change it. Don't try and fix it. You're going to want to try and make it feel better. That's not helping the child build their own coping capacities. Again, I think as some folks earlier kind of mentioned, you also want to kind of, depending upon the age of your child or the developmental stage of your child, it's really important to use child-friendly language. So you want to name it a vaccine instead of a shot. You can see the difference if you call it a shot. That's kind of scary language to a child, depending on what their experience is with that language and that terminology. So name it as a vaccine. Maybe talk about it feeling like a pinch instead of a burn. And maybe talk about the staff in the clinics as helpers to make the connection that they're there to try and help them receive the vaccine and not hurt them with a needle. The other thing you might want to consider, or for your consideration, is you could say something like, if you're trying to explain, when you're talking, you're trying to explain what they can expect at a clinic. So you can describe it something like, first we'll check in with a helper who will ask for your name. Then they might ask you to kind of sit and wait. When it's our turn, we're going to meet our nurse and she'll show us where we can sit. The nurse will wash an area of your arm to make sure there are no germs. Might feel cold, and the wipe might smell like hand sanitizer. Next, you're going to get the vaccine through a small poke. You might feel a little pressure or a pinch, but it will be quick. And then you'll get a Band-Aid and it's done. You also want to talk about, why are you getting the vaccine? I've heard some of my colleagues in child life at IWK Health describe the vaccine like a superhero shield to protect us from sickness that's caused by germs. The vaccine will teach your body to fight against COVID-19 germs to keep you safe and healthy. You can also make reference to the other vaccines your child may have already received, or immunizations, because a lot of between the ages of 5 and 11, they would have gone through this experience many times of having needles. And so if you're talking about previous experience, it helps to recognize that this isn't a completely new experience. You want to try and talk about the vaccine in a positive way, and maybe say something like, you know, by keeping your body protected, you're also keeping your friends, your family, your teachers, and other, your grandparents, and other members in the community safe. So tidbit number 1, tune in. Tidbit number 2, talk, talk, talk. And then the last one, tidbit number 3, I call it tackle the play-by-play. So basically you're going to unpack everything your child is going to see, hear, smell, and feel. The more that they're able, and then you're going to develop like a care plan with them. And so the more that they can be a part of the decision and the development of the care plan, we know the better or more positive the experience is going to be for everyone involved. So things like, you know, what clinic are they going to attend? Where is it located? How child-friendly is it? How do they want to sit when they receive the vaccination? What sort of comfort items would they like to bring along? Is it a toy? Do they want to sing a song together? Maybe some deep breathing, or watching the phone or tablet, or maybe coming up with a comfort plan, like maybe when the needle is going to go in your arm, you're wiggling your toes. Or mom or dad are asking you rapid fire questions like name 5 friends, 4 sports, 3 types of fruit. Or maybe playing I Spy are all great ideas. And the numbing cream has already been mentioned, or squeezing a ball or cuddling a stuffed animal, telling a story. Children also like to pretend that they're blowing bubbles or a pinwheel going around, or other ideas. You might want to ask and be curious around, do you want to watch the poke? Do you want to sit on my lap? Do you want me to sit next to you? Do you want me to hold your hand? Obviously, these aren't rapid fire questions with your child, but these are some of the things that you can be asking to draw upon to create a plan that's going to meet your child's needs. We can also talk about, like, what should we do before we go for the vaccine? Before, during, and after. Because there's a beginning, a middle, and an end to consider. So you might want to also, you know your child best. So do you start to have the conversation, you know, a couple of days out or a week out? How much does your child need? How long does your child need to kind of process the information? You're the best people to kind of make that determination. And then you want to titrate the information that you're giving your child, meeting their needs. I guess I would also say that your best position, as I mentioned earlier, to kind of help them organize their feelings around everything. And then as you start to think of younger children, you want to think about play being their language. So maybe you want to practice it. So play it out with the younger children. So use a stuffed animal. Ask what would make the stuffed animal feel better. And with older children, you might just want to check in, you know, that the plan you made, is this still our game plan when we go tomorrow for the vaccination? And then it's important to recognize that it's not over when it's over. So you want to talk about the experience. You want to talk about what went well and celebrate it. You know, if you're able to, you want to agree on to do something enjoyable after your appointment. Maybe get a donut, bring a snack, and stop at the park, play for a little bit. The whole idea of focusing on what went well can also help it to go better the next time, recognizing that you're coming back because you're having 2 doses. And it's really important to state that the celebration is not about rewarding the experience. It is about having your child have something positive to focus on as they are having the vaccination. It's to keep their mind on something positive. I guess what I would say is that there's lots of great resources. You can just Google, you know, how to support your child through the vaccination experience. The kids have some great resources that you can explore, and I can share some of the resources. We always have a lot of our favorite things that we like to use at IWK Health, so I can make those available to Veronica and to Sharon after tonight's session as well. So to recap, we're talking about Teresa's tidbits, right, to help with the emotional component of the vaccination experience. So we've got tune in, talk with your children, and you want to kind of tackle the play-by-play. So basically a calm presence, proper prior planning, and truth telling. I think I'll end it there.
Great, thank you very much, Teresa. That's wonderful. So we've gone through our presentations and we now have time for Q&A. You can put your questions in the chat or raise the little hand symbol. We'll keep an eye out and ask anybody to.
Folks may be shy, but I know that just want to say thank you to every one of the presenters. You all brought such terrific points to us. You helped us understand things clinically, physiologically, and emotionally. And that firsthand information from parents, Ms. Trina, is so important to us. People want to know that that it is a receptive, or that people are receptive to questions, right? That they feel comfortable asking. No question is a bad question. No question is a wrong question. And we as a people are certainly very, all people are very concerned about their children in African Nova Scotian communities. Our children, they're our hearts. So and people want to be protective of them. But I think it's really great to hear some tips from Teresa about how to support them. Very helpful. And maybe people could, if you don't have a question at this point, maybe you'd like to just comment on what you've heard. Both are very welcome now. Anyone?
I have a question, and I posted a bit in the presentation in regards to the families wondering, will this be mandatory? Will children be expected to have this vaccination in order to attend school? Do we know yet if that's the case? And then knowing and wondering, and this has also been a question, will there be more mental health services provided directly within community to help support many of these moms who are coming forward with great concern and that anxiety?
So Ryan, maybe you can take that first one.
Yeah.
And I don't know, Teresa, if you have any idea about the second.
Yeah, I can start off. At this point in time, there's no intention to make the pediatric childhood vaccine mandatory. Actually, in Nova Scotia, none of our childhood immunizations are mandatory to enter school. They're obviously strongly encouraged. And there are only, I think, 2 or 3 other provinces in Canada where you actually have to have all your vaccines to attend school. In our province, everyone I agree that school essential activity. We need kids in school. So we would want kids that being vaccinated should not discourage someone from not going to school. So there's no intention to make it mandatory. Right now, the mandatory or proof vaccinations required for non-essential activities. But I'm assuming once children are fully vaccinated, and depending if the mandatory, the proof vaccination policy is still in play a couple of months from now, in order to attend certain non-essential activities, children may also be required to show proof of that. Obviously, if they're going with their parents have to show proof that, that's one way they can attend. But there hasn't been any talk right now at this point to extend the proof vaccination policy to kids to do non-essential stuff. It's going to take several months to get the vaccines in arms. One of the things that have been recommended for these childhood vaccines is that they should be actually at least 8 weeks apart. They've been approved to be at least 4 weeks apart. But to get the best response to your immune system, we're encouraging people to space them out up to 8 weeks. So vaccine should hopefully be available sometime early December, and then won't get second shots until until February. So it takes some time to actually get those shots in arms. So I hope that helps answer your question.
Thank you. Teresa, do you want to take the second part about the mental health support? I don't know.
I understand, and speaking with Veronica and earlier on, I believe she said that ABSW is going to continue to provide mental health support for families through the COVID-19 task force. Veronica, maybe you'd like to talk about that a little bit more?
Yeah, we do. We more or less triage it. It goes to Hawk, who then determines who's the most applicable. They do the intake, and then they determine what mental health clinicians we have out there that we can refer it to. I think and Trina, you can correct me if I'm wrong, you're looking for resources in your community, so outreach resources. Is that correct?
That is correct, but also specifically, and maybe this is something we could talk more on in the end of this. I do feel that there is a need to have somebody maybe come in and do a few presentations directly to staff, whether it be one-on-one or in a group setting. Staff have asked me to reach out for those supports for them, and I'll connect with you.
Okay, and there are a couple of social workers and clinicians around. So maybe, yeah, we can talk about who we can utilize. And Teresa, I don't know if you guys do outreach at all at the IWK, but maybe we could chat about how we can be of assistance to the communities.
Sounds great, sure.
Yeah. I see
Sherry.
Dr. David Sherry has her hand up.
Yes, I see Sherry is Sherry, go ahead, please.
Okay, thank you very much. I have a question and some information that I want to share. The question is to Dr. Allen, who talked about the myocarditis and pericarditis that could possibly affect this age range. I just want to know, is that something that can be cleared up, or does it do any damage to the heart? And the other thing, before you answer that, I just wanted to let Trina know that if you're looking for information for young kids or for them, I know one of the things that the young kids like is Dr. McStuffin, who is culturally relevant. And if you're looking for additional information, you can contact the Dartmouth Library, because Crystal Mulder has just taken a position there as the special advisory specialist for the African Nova Scotian community. So she might be able to provide you with resources that you might be looking for, or at least give you information on that.
Great.
That's good, Sherry. Thanks for that tip.
Thank you, Sherry.
You're welcome.
Upton.
Okay, great. Let me just make sure that, oh yeah, good. I thought I was on, yeah. Okay, so first of all, the myocarditis, pericarditis, this entity would be expected to be extremely rare if it does occur in the pre-pubertal children, in those, less than 12. So to be very rare. What we have seen so far among individuals over 12 who have had pericarditis, myocarditis, is that it's overwhelmingly mild. It is a serious illness, but it is rare. Some individuals can have it severe. So just being very frank and open with you, some people can have it severe, but it is very rare. And when it does occur, most of the kids require no real fancy treatments. They need over-the-counter type medications. Some might require other types of medications, and most of them actually get better without any major forms of treatment. What a cardiologist would tend to advise for some of those who have more moderate to severe illness would be to be mindful of strenuous exercise for a period of time, a month, 6 weeks or so, depending on the severity of their illness. And those would be mostly for competitive athletes. They would be advised to exercise caution with excessive exercise. But the bottom line is that it's overwhelmingly mild.
Thank you.
Welcome.
Upton, do you want to just tell us about, is this vaccine being given out in Ontario yet? 5 to 11s? Not yet, eh?
Well, we just started today.
Okay.
Just started today. But what I can say, David, is, and you've alluded to this, and that is, how does one prepare a pediatric-friendly environment? And so one needs to take into account what are some of the issues that might come up with children. So, for example, if you're having a clinic and it's in a large open area, such as a gym or a hall, concert hall, convention center, it might be problematic if the kids are lined up, because if one of them gets vaccinated and starts to cry, then it affects all of them. So therefore, the kids' vaccination, it's a child-friendly environment with balloons and clowns and ice cream and all of that stuff would be ideal. But it's best done in a small, structured environment. So even if it's in a gym, there are little, maybe dividers that create some, that allow for the creation of rooms, so to speak, so that there's a smaller, structured, protective environment where, a parent can hold a kid and sit down, and it can be, in fact, a cool down zone after. Then the exit area would need to be thought about, because you don't want to vaccinate a kid and then have them leave through the waiting area with another 20 kids, seeing them leaving with tears. So if anything, they shouldn't cry, but if they follow Teresa's tidbits, they should be good. But if they do leave, you want them to exit through an area other than the waiting room where everyone is hanging around. So I think it's just important to just remember some of those things. And those are the things that we're putting in place in Ontario to take care of the fact that, the kids will cry, a kid will faint. And if a kid faints and the others see that kid faint, they all leave and go home. So you just have to try to avoid those situations from happening. Tell them what they need to do, talk to the parents to minimize the chance of fainting, squeeze your knees together, and all those kinds of things, a little tidbits that can be helpful. So the bottom line, David, is that it's a child-friendly, specially structured, small structured environment.
Okay, great, thank you.
I just want to jump in with, when we talk about child-friendly, Ms. Trina is definitely our expert on that, because not only is it about being child-friendly, but it's also about being Afrocentric and friendly in terms of our cultural reality. So you see Black kids in many situations, Ms. Trina. What do you think, based on your years of experience, that we could do to support our kids before they get to to the vaccine clinic, but also what would you describe as a child-friendly environment, which is also Afrocentric? Can you tell us a bit about that?
I think educating them along with their families, definitely before they go to a clinic, to what they might expect or what they might see. Dr. Allen, when you talked about having that child-friendly, having the ice cream, the clowns, the balloons, Veronica, I want to say, where was our ice cream? But just, and then I'm also thinking about places within our communities, within our African Nova Scotian communities that you are right, Dr. Allen, in respecting the fact that if you line the children up and the one in front starts crying, yes, the next one's not going to want to. But one thing I do identify, and I don't mean to put our children on the spot, but just thinking about our center, and my thoughts are, it's most times that those children will support one another. Those children look up to one another in the sense of knowing that if my friend Johnny gets his vaccination, I'm going to get mine too. So even looking at like peer supports, and looking at, I'm thinking of our center, knowing that we could set things up that would allow them to go in one-on-one, taking a family member in with them and not having that nervousness, or setting up appointments within communities. And there's several different places within our communities that could be set up to be made child-friendly, but also even having that special person from the community that children may look up to, having them present. But again, I think the main focus would be making sure that the families are educated and aware this is what to expect. And again, being truthful, like Teresa said, speaking the truth. I think that would be the way to go.
Thank you.
Dr. Ryan, you provided some in the chat, some resources that people can utilize. And I was looking at the 5 strategies that you covered as well. And I was thinking, oh, darn, we could have used those 5 strategies, David, in our upcoming newsletter, but now we're out of space. So unless you have another 3 pages to go with that, yeah, no, those are very good, but I still think there's some merit in us probably, if we're permitted, to copy it and have it as an insert in the news.
I think Teresa's tips are great. They're very practical to the point where they walk you from like beginning to end. So
Yeah.
it gets you, I don't think you get that in the paper or get you on the radio or something like that. Like those are really, I think those are the practical tips I think families need. So that I like how you walk them through from beginning to middle to end. So.
And I noticed from the chat that Dr. Strang is going to be doing a press conference tomorrow at 11 to
Yes,
talk about the rollout of the vaccine.
He hasn't said anything to me yet or other medical officers of health, but I suspect the way this is me guessing, but what you happen is they'll prep, like we just had the announcement on Friday of the approval, and then there will be usually a press conference to say this is when we will open up bookings online, and then usually they'll say sometime after that is when the rollout will happen. So that's what happened for the 70 plus vaccines. They said we're going to do it. Okay, now this is when you can book, and then once you can book, this is when these are the dates you can book for. So my suspicion is clinics for mainly a pharmacy model, like outside, if people want to get outside of a specific clinic, that it will open the pharmacy model probably the first week of December. There are about 68,000 kids in that cohort, which actually it seems like a lot, but during the peak of our vaccine rollout, we in 1 week we vaccinated like over 100,000 people in just like a 7-day time period. So it should be a relatively quick, like air quotes quick turnaround time, but it's going to be about 8 weeks in between first and second shot. So, and we'll get probably more details around the nitty-gritties of the rollout.
Great, thank you. Sherry, before we turn over to Dr. Allen, I see Sherry has a couple of great comments in there as well in terms of kid-friendly environment. So similar to at our clinics where we have videos and you know, showing on the screen at the churches, we could have some cartoons available or something for the kids at the clinic. So, and some music. That's a good idea, Sherry. All right, Dr. Allen.
Thank you so much. I can share with you some of our experiences with the clinics for teens. And one of them, for example, one type was so often connected with various diaspora groups. So one was the Jamaican Canadian Association in Toronto, as an example. And essentially, it was a family event. And there was music, and there was food, and there was ice cream and everything. And parents got vaccinated, and the teens also got vaccinated. And so, again, that's just one model where you could make it a family event, because there are still some parents who are still somewhat hesitant. And so if it's possible to have clinics that provide the opportunity for there to be two streams, don't mix up the doses. The purple and the orange are different, but are two different streams, then that might be good, i.e. a family affair.
That resonates, I think, too, with the idea of, I don't know quite how we're going to go forward, but this is the conversation that we need to have that will give us some ideas and some suggestions around, you know, what it looks like or what would be best for us. I like Brother Archie talked about having some of our children read from their work, and I think feeling empowered in that situation. I'm no child psychologist, but I know that as a nana, having my boys feel that they are in charge of the situation and feeling confident about it certainly helps in any situation. So I think that's really cool. I can imagine little contests of different things as well, as part of a kind of a strategy, you know, like, you know, what happened when I had mine, you know, in the US, of course, I can't believe I'm saying this. I can't believe it's true, but there was controversy with Big Bird. Big Bird said that he had a shot and his little wing was sore, but he's okay. And, you know, and I think that, you know, maybe, I don't know Mr. McStuffin, but maybe Mr. McStuffin having that story would be cool too. So anyway, I think our imagination is you know, we're as open to things as we can imagine. Teresa, you're smiling. I'm wondering if you want to say something about that.
No, I was just enjoying the Big Bird story and the Dr. McStuffin. Yeah, I mean, I think they're all wonderful ideas for sure. I think it's, I appreciate you commenting on, you know, the building of the child's confidence. It's really important and essential. That's another reason to celebrate the experience too, right? Because they just did something that was really hard to do and they did it, right? So that just solidifies another experience and their repertoire of tools that they can do hard things as they have to navigate hard experiences throughout life. So powerful.
Brian, you had a comment?
Yeah, just to sort of follow off what Teresa said. I've heard a couple of stories of how you can really impact kids, be resilient, and get the courage to get a vaccine. And one way is to, I heard this one story, this little little boys from the States. He was vaccine eligible. He wanted the vaccine, but his friend, who is, I think, on cancer treatment, someone who's immunocompromised. And so obviously that his friend is prone to getting any virus, let alone, the COVID virus. And so he wrote down his friend's name on a sticky note to take it with him. And remember, like, I'm doing this for my best friend. I'm trying to protect him as well. So I've heard other, people actually taking pictures along of family, and like kids are, very altruistic. They want to do what's right for their family. And so taking those little keepsakes along will help them, remind them why they're doing it as well. So I'm not sure there's any scientific evidence that works, but it's another way, depending on the child, what motivates them, or what would be an incentive up for them to get vaccinated is another thing to think about.
Great, thank you.
Dr. Allen had
Yeah.
a point to make or a question.
Yes, I wanted to make a comment that relates to messaging around prioritization of certain groups of individuals because of the burden of COVID among those groups. And obviously it varies across the provinces. So areas like Ontario and Quebec, racialized groups are have been most significantly disproportionately affected. And so with the rolling out of the adult vaccines, one would prioritize certain neighborhoods. But we think that for children, that would be the wrong message. And we don't want for there to be any misinterpretation of intent. So rather than talking about prioritization, we're talking about ensuring that everyone is on level ground and nobody's left behind, so that groups that are in lower socioeconomic zones get the supports that they need to get to be on level ground. Because what you don't want is for them to feel that they're being prioritized, and that that's one way of people seeing what happens to them first before others get vaccinated. So it's just the messaging, so that there's no misinterpretation of intent. Vaccine will be available for everyone, level ground, and nobody being left behind.
Okay, this is great. Does anyone have any additional questions or comments?
Just one quick thing, and this is a little thing that some people might not have picked up on, but the National Advisory Committee has recommended that there should be 2 weeks between a flu shot and a COVID shot. So that's one thing to be aware of, that it is the time of season for people to get flu shots, but when they're planning and ready for that, if they've gotten a flu shot, they should wait 2 weeks afterwards to get their COVID shot.
That's important for us to note as we prepare to write the script for our booster shots. So yeah, we'll make note of that for the script. That
I'll have to double check for that one though. I think like for adults, they said that it could be co-administered at the same time. But I'll double check and get back to you guys. I'll message
okay.
Yeah, you're talking about the children.
Adults.
Just for the children. Okay.
Yeah,
Where you at?
children.
Yeah, just
The
for
adults,
children,
I
it's
think,
2 weeks.
Yeah, I think you're right. I think the adults can get them together.
Yeah,
One in one arm, one in the other arm.
Yeah, exactly. For the kids, the truth is that the feeling that from the science point of view, they could get them together. The issue is that you don't want to confuse what's causing what in terms of side effects. So because of that, NACI felt, listen, out of an abundance of caution, let's separate them. But in terms of the science, I mean, they're fine. It's just that adverse events, NACI felt that it was important to separate so you know what's causing what.
which is what they did with the adults initially when they
Mhm.
were just starting as well,
Yeah.
just so you don't confuse things.
You don't confuse. Yeah.
Yeah.
Oh, Dr. Ryan, you wanted to say something?
So this might be another common question comes up because it affects my oldest kid. So if your kid's 11 and will be turning 12 soon, do you wait to get the adult version or you stick around and get the kids version? So my own intention for my family is that we will get the vaccine when it's available and use the pediatric version. And as like Dr. Allen has laid out during his talk, you need a smaller dose in kids because their body, they want. So to get it now, because if you have to wait, if your kid turns 12 and then that could be a couple months later, and then another shot, to 6 months or 8 months later. So it's probably best to use what's available now and get that as the shot.
That's good advice. I hope everybody was clear on that. Can you just give us the 3 points there, a 3-point bullet? If your kid is,
so if you're 11 and we turning 12 soon, what most experts are recommending, I think all experts are recommending, is don't get the dose at that time.
Don't wait. I'm saying that because you're breaking up a little bit. So yeah, don't wait. Get the pediatric vaccine as soon as possible, right? Rather than
correct.
Wait. Yeah. Okay. Just wondering too, we have a little bit of time and I wanted to just get to the questions that that you were hearing, Ms. Trina, and that others may be hearing in community. Understanding that no question is a wrong question or a bad question or a stupid question. I'm just gonna name it, get it out there. People have concerns. And from the time we started doing town halls, we were dealing with, we knew a lot of misinformation that was out there about vaccines generally, and certainly a lot of misinformation targeting our people as well. We've gone through this, it seems that with every wave, there's more information, both good and bad, out there. So would you mind, people online, and Ms. Trina, I don't want to put it all on you, but what are some of the questions that our parents, Black parents, African Nova Scotian parents have, or the reservations that they have? If you name it, then we can sort of, address it, kind of thing.
I guess the biggest, it's there, and most times there's not many questions. There's more comments and thoughts and feelings. And some of the things that folks have brought forward in regards, and I mean, those of you who know our communities know, in most recent, there's been several people who have passed. So there's a lot of concerns there. And when we hear concerns about the swelling of the heart and those types of things, it's like they're putting together in their own minds, is this why so-and-so has passed? So there's been several thoughts and comments posed in regards to those situations. And there are people who were ready to be vaccinated and have turned away, have walked from their jobs because they've lost loved ones, and they're putting the blame on that. So I guess, how do we reassure them that this is safe, this is fine? And the only response that I can ever give is that I am not the professional, but I've directed them to doctors that I know they could speak to. And I'm thinking, if there are more doctors and more social workers that could make themselves available to answer those questions, that's what we need, because I can't answer them.
We hear you. Yeah.
I can respect their opinion, and I've said that openly. I respect what you're saying. And some of them have asked, have I gotten the vaccination? What made me decide that I was going to get it. And I said, you know, there are many things that we do in life and we don't know what the answers are or that, but I put faith and trust in the professionals who have said, but again, in me saying that, I know there are other folks who they've had experiences and issues with trust. So I respect their choices.
Mhm. Dr. David, we always, or put it this way, in past town halls, we've talked about that very thing, mistrust for our people with the health system, and I can understand too that when you have a community or communities, because I always say that we're not just one, we're very diverse. That there would be concerns about, sorry about the phone, there would be concerns about, you know, how we are treated, or how if we're disproportionately affected, and some of our people unfortunately have passed away as a result of COVID, then they connect that to the vaccine. So that kind of confusion is problematic. Dr. David, could you sort of take us back to the beginning when you talked about mistrust and why it's understandable, but then also what are the messages about protecting ourselves and being strong as communities?
Well, just sort of put this in context. I mean, when someone comes forward, well, first of all, Trina, if you have individuals that approach you and need more information, ask them to call the COVID, the toll-free line. You know, we don't have huge numbers of resources, but we can help. And if needed, we can reach out to, you know, community groups and have those kind of discussions. But I think it is very, we have to acknowledge that there are reasons why people of African descent have mistrust of this vaccine. And it's not just a historical thing. People look back and talk about, you know, yes, slavery and all the things that happened coming forward, experimentation, medical racism, all those things. But there are things going on even today, and we don't have time to talk about all of them, that, you know, do not kind of generate that trust of the medical system. And so you bring a vaccine now that you're saying is needed, and, you know, this COVID thing is here and it's been developed so quickly, and, you know, all these things. And then all the things on social media about, you know, is it gene therapy? Is it this? Is it that? So, you know, there is good reason for many people to have that mistrust. And I think the most we can do is to listen and, you know, hear what the things are, and then to give our perspective. One of the things I never try to tell people that they should get the vaccine. It is a personal choice. It's a balance between, you know, there is a vaccine, there's good things about the vaccine, but there's some adverse effects. But there's also COVID, and there are bad things about COVID, you know, and so it's a balance between, you know, having those choices. But you give information and allow individuals to make up their mind. And, you know, there are people who will listen and will think about the things and look at the resources, and then we'll say, okay, yes, I will do this or the other. There are some people who will just be adamant. They have fixed beliefs and they're not going to change. And again, it's not worth having fights with people, or, you know, but you know, the bottom line is, yes, we hear and we acknowledge that you have good reason to have this kind of mistrust of what's going on. But we want to be there to have a discussion as best as we can to see if we can give you our perspective that might make a difference. So, I think that's my approach, basically.
Others want to weigh in, comment on that?
Yeah, I can, a couple things to suggest. So yeah, it's really about trying to find underlining what are some of the concerns. So, is it they need more information? Is it, there's been a bad personal experience with vaccines, or they've had a bad experience with someone who's had COVID? Are there needle phobias? I think that's one thing to look at. Like, everyone seems to think people not getting vaxxed are just anti-vaxxers and they have a certain mindset, but there's some people, like, because of stuff that's happened in their past and in their family's past, it's really hard for them to actually get a needle in their arm. One of the greatest pieces of advice I got through my family medicine training is when you're talking to someone about their medical issue, there's all the specific questions doctors, nurses, and others will ask to understand what's going on with someone's disease. But the biggest thing that we taught us in family medicine is to do your FIFE questions. So your feelings, ideas, function, and expectation. And with individuals helps, like, try to unpeel and figure out what's below this. Is there something underneath this that's really driving their concern and anxiety? And I think the other really powerful thing, and this is what you guys are doing with town halls like this and all the supportive work you're doing around COVID and now beyond, non-COVID stuff, is having a peer-led process. So it really helps when people from your community, people and who you trust, if they're championing vaccines, that's going to have a more profound, powerful effect than sometimes the media campaigns, social media campaigns. If people's own peer groups and social groups are getting vaccine, that will be much more powerful in providing more information. And I've seen this in everything, like whether it comes to breastfeeding support, talking to kids about the dangers of drugs and smoking and vaping. And it's one thing for professionals, we can come in and say and provide information, but it's actually more powerful. We can really arm the people around them with information and support as well, and tell those stories that it's going to be more effective, even additionally effective, to get the vaccines in arms.
Thank you. I see that Carlos mentioned about bad experiences with the whole health system and need for the system to demonstrate that they care about our people, because in fact, we have a history that shows abuses of us collectively, and certainly many individual experiences as well. So I think it would be a balance, wouldn't you say, Dr. Allen, about, you had mentioned sort of not to kind of make us special in a negative way, but rather that, with us, we talk about the need for culturally specific approaches. That is the initiative's kind of way of doing business, because we want to make the clinics accessible. We want to respond culturally to our needs, to make them inviting, and also to have people feel trust when they come. So there's that piece, but there's also the piece that, we don't want to be pathologized or we don't want to be made out to be, a sick people. So it's I don't know if I'm expressing that very well, but I think it's like trying to find the right balance of that. Yeah.
Yeah, no, I do agree. I think that that we want to ensure that people get the support to enable them not to be left behind. I think that's really important. And to David's point, I really, David and I are on exactly the same page, is that we just want to make sure that when people make decisions, they are not making those decisions based on wrong information. We just want to ensure that they have the right information. Now, when they have the right information, if they decide that they don't want to be vaccinated, that's another issue. Just want to ensure that they have correct information. And to that end, how might we assist people? What we're trying to work on doing a better job in Ontario is to point out the sources of accurate information. And we're saying to people at this stage, listen, you know, as bad as it sounds, you know, forget the internet, forget WhatsApp. Go to your local hospital, your school, your family doctor, public health unit, and just identify a number of narrow pathways that people can get access to information. Community leaders who can be trusted, I think are, you know, part of that group of information providers. But the key is to get people to redefine what they mean by "I did my research." In other words, some of them have access to the deep internet, and it's really bad. I had a colleague who actually David knows this person whose you know, housekeeper said she's not getting vaccinated. And neither will any of her kids, because she did her research. And our colleague said, well, where did you get this information? She said, WhatsApp. And that's, so my colleague joked and said, oh, you mean the University of WhatsApp? And he meant it as a joke, but the point is that people do get their education from that. And unfortunately, it can be a problem. So we're trying to redefine that to say, okay, no, go to your public health units, the schools, the hospitals, your doctor's office, your, you know, whoever you look up to. And then we just need to ensure that those places have the appropriately culturally sensitive information available.
Fair enough. Thank you. So I think I want to give Dr. David, I'm sure you'd agree, and Veronica, we want to give people a chance to comment, a kind of a last chance to have a word. I see some of our friends who have been with us through the whole session, but we haven't heard from them. So there's the invitation if you want to sort of give us a parting comment. Sister Lana has her hand up. We're listening.
Well, thank you very much. I'm sorry I'm getting on late. I just have a quick question, and you may have already answered this. My daughter is 11 and a half. So with the upcoming vaccine, like my husband had a question is, does she get the adult dose at 11 and a half because she's carrying on to 12, or should we wait until she's 12, or should we get the vaccine for those that are 5 to 11? That's kind of, we're in this little precarious developmental stage.
Well, Dr. Ryan has an answer for you.
We did discuss that, Lana. It did come up. So.
I'm in the exact same boat. I have someone who's turning 12 in my household in March, and what I've seen, reading through advice from other experts and some of the pediatricians and infectious disease experts and public health docs is really take advantage of the vaccine that's in front of you right now. The vaccine dose is a third of the amount as the adult dose, but what Dr. Allen showed us at the start of the talk was the kids have these great robust immune systems, and they don't need as much of the vaccine to actually trigger or turn on their immune system. So they get a very good response, and with a lower dose, you actually have fewer side effects. So The other thing about waiting as well, like my son will turn 12 in March, so that's another 3 months away, and then the recommendations are you get a second dose 8 weeks after your first dose, so that's then taking us into May. So it's much longer. Get my child vaccinated, and what we're seeing a lot now in fourth wave in Nova Scotia is the majority of our cases are kids under the age of 12. Like we've got a lot of outbreaks and a lot of exposures in school settings, and we've had to shut down a couple schools for a week to let COVID run its course and not spread any further. So if it's available now, take advantage of it.
Great, thank you, Dr. Sommers. So, all right, any of our friends online have anything they would like to say? I'll give you a second, and then I'm just going to ask our panelists to kind of give us a word of advice or a word of closing if we don't hear from our friends online. Anyone?
I do, before they do, Sharon, I do have a point of clarification at the beginning. I had mentioned a particular number for toll-free of calls that have come into our toll-free line. I've done a quick calculation, and we've had over 2,000 calls that have come in since the initiation of the toll-free line. We've had, in the last report, it was 900 and some. So, and since June, 250. So over 2,000 calls to our toll-free line. So
all right.
Yeah.
We are answering some questions out there. Okay, that's terrific. All right, so you got an applause all around there. We're doing good work. Okay, so I'm going to then ask our panelists, just whatever's in your heart, what's on your mind, a sort of parting shot for our people as we leave, because as I will say at the end, this is recorded and will be available to people. So there are many people probably who weren't able to be here tonight who will be watching this. So everything you've said is valuable and will be appreciated in the future. So over to you. No particular person first.
Guess I can speak. Just what's on my heart right now is Sharon, like you said earlier, those little beings, those little souls are our heart outside of our bodies. It's going to require us to be courageous and brave as we move forward. So I just extend that invitation that your feelings are real, and yeah, be courageous, be brave, reach out, connect with someone. Definitely talk about what works for your family, and you're the only person that can make the decision for you and your family. So anything I can do to be helpful, definitely don't hesitate to reach out.
You've been fantastic tonight. Thank you so much, Teresa. Ms. Trina.
I'm just going to echo and say I value how we've, as communities, have come together and have supported. I value how many of our young folks within our communities have stood strong and firm to get information out there to everyone. And I think just together in whatever community we come from, continuing to support one another, being positive, respecting one's decisions, and just going through this together. Yeah.
Thank you so much. Thank you so much. Wonderful. Doctors? Dr. Ryan?
Oh, okay, sure, I'll go ahead. Well, thanks for inviting me to participate. I enjoy these town halls. I get to interact with people. Like I spend a lot of my days trying to contain COVID. So it's nice to actually talk to real people. And I actually learn a lot of these sessions too. I learn a lot about what communities are doing and what are the challenges. Thank you for inviting me. I'll just three key messages. I always try to make three key messages. And that's what I would say is that, remember, the vaccine is probably the best way to protect your children, your family, and your larger community from COVID. It's going to help us get out of the pandemic and get back to our new normal. It's safe and effective, and we talked about a lot in the presentation. And then finally, the vaccine is going to let kids be kids again. So we'll keep them in school. We'll get them back doing their sports, extracurricular activities, and again, hopefully getting back to normal. So, and the last thing is, I really like Teresa's tips. So I mean, follow those as well. Like, they're really practical, walking someone through. Like, you should definitely get those published or marketed or trademarked or something. So like, those are very, very useful for families. Yeah.
Terrific. Thank you so much. And yours were as well. And I know that people will be really, really feel informed upon looking at that, at this in the future, and for those who have joined us this evening. And to last but not least, our esteemed Dr. Allen, what would you like to leave us with?
Oh, thank you so much. I would say that it's important to, number one, to remember that Health Canada, the FDA, have looked at the data that have been generated by the company, in this case, Pfizer, because that's the one that is first through the gates, so to speak. And the benefits outweigh risks, significantly outweigh risks. That's number one. Number two is that one acknowledges that there are risks, but for this age group, it is expected that the vaccines, in terms of the risks that people have talked about, namely the inflammation of the heart issue, that's expected to be very much rarer than the older age groups, for whom it was already very rare. So if it's going to happen for this younger age group, it'll be a very, very weak signal. And if it does occur, the kids generally tend to have it mild. I guess the third thing I want to mention is that, and Dr. Sommers alluded to this earlier, when Health Canada looks at evaluating these vaccines and makes approvals, it doesn't stop there. Monitoring continues. But it's also very important to recognize that the side effects that are usually associated with vaccines are not ones that surface in the years to come. They tend to happen within days, within weeks, within a couple of months, not a year from now, 5 years from now, 10 years from now. And I think it's important for the public to remember that as well.
Well, thank you so much. And thank you to all of you who have joined us this evening. It's been really important. We've taken our time, and I think we've really, covered the waterfront in terms of questions and concerns and hearing many perspectives. It's been great. Thank you so much to my always to my brother and sister co-hosts who we do this. We're going to be doing it again soon because our priority is to keep our people informed in every way we can. So this is really great. And to that end, I want to remind you all that we do have a YouTube channel and Hawk YouTube channel. And this will be available. It won't be available tomorrow, but it'll be available fairly soon so that you can direct people to it, so that if they've missed this, and Ms. Trina, I know you had a number of parents who you wanted to join and hear. So, direct them to it and let them be able to listen to it on their own, in their own time. Those of you who wanted to ask questions, might have been shy or weren't in the mind frame to do so, and you want to write them in to the to Hawk, We always make every effort to answer your questions and to get back to you. That toll-free line is there, as Ms. Veronica has said, always available for you. So thank you all, panelists and participants. Mean so much that you've been with us this evening, and we wish you health and blessed night. Thank you all.
Bye, folks.
Night, everyone.
Bye-bye.
Thank you. Bye-bye.
Right, and thank you,
Bye.
everybody.
Bye.